Hi, this is the host of the YouTube channel Cancer Video 08 speaking. I will now discuss my interface with a cardiology professor regarding Dr Caldwell Esselstyn's research on heart disease and my interface also with a highly respected endocrinologist regarding Dr Gabriel Cousens' work with diabetes. Please respect that I will not discuss names, occupations and locations beyond what is contained in this talk, including my own. For the record, I am not vested or interested in selling anything to anyone. I am neither vegetarian nor vegan. I eat a wide variety of foods. In mid-2008, I attended two separate presentations. One was by a cardiology professor, the other was by an esteemed endocrinologist. Both presenters finished off their presentation by asking of the audience that if they had any additional information to offer in the fight against heart disease and diabetes respectively, could they please forward their information to them. In reply to the cardiology professor, I submitted a copy of Esselstyn's paper titled Updating a 12-Year Experience with Arrest and Reversal Therapy for Coronary Artery Disease, an Overdue Requiem for Palliative Cardiology, published August 1999 in the American Journal of Cardiology. I also sent a copy of Esselstyn's lecture, Make Yourself Heart Attack Proof, on a memory stick. I also let the professor know that I have Esselstyn's book titled Prevent and Reverse Heart Disease, and that he is welcome to borrow it. Additionally, I sent him a copy of Dr Gabriel Cousens' DVD titled Simply Raw, Reversing Diabetes in 30 Days. I will now read the professor's email response. Hi such and such. Sorry for not responding earlier. I was not aware of Esselstyn's work. It, of course, is interesting, but is of somewhat marginal relevance due to the difficulty of following the stringency of diet recommended and the small numbers he has studied. The studies I quoted on regression versus come from large-scale studies using intracoronary ultrasound. Look up papers by Steve Nissen and S. Nichols. You might also be interested to look up some nice work done some time ago by Dean Ornish of a rather rigorous diet, exercise, psychological group intervention with angiographic correlation before and after, where there was some regression as well as failure of progression in the days before statins. So I believe it is possible to see regression, but the major impact of the stringent interventions, or high-dose statins, HDL or ApoA melano infusions, is to stabilise the plaque and to prevent regression. Thank you for your interest. Regards, Professor such and such. I will now read my return email to the Professor. Dear Professor such and such, I have looked at the latest work of Nissen and Nichols, both of the Cleveland Clinic, as is Esselstyn. Whilst their work is of no doubt great value, their work does not approach the significance of Esselstyn's regarding patient outcomes, in my opinion. Caldwell Esselstyn managed dietary compliance from 17 to 23 patients, 74% compliance, in a study for which he had no major precedent. The diet may have seemed stingy, but the participants are rewarded with greater exercise tolerance and less anxiety regarding future cardiac events, along with other benefits. I sometimes ask cardiac patients about their condition and diet in hospital. Some claim to have not discussed associated diet with their doctor. I have witnessed a 36-year-old Islander male eating McDonald's in an acute coronary bed. Anecdotal, but hey, with professional deliverance, cardiac patients might find the outcomes of Esselstyn's work inspirational and useful. I haven't had the elephant sitting on my chest, but if I did, Esselstyn's work does not require the patient to induce additional medications that could pose unforeseen risks or side effects. From my point of view, it's a pity subsequent studies to Esselstyn's are not in progress, to my knowledge. Perhaps the 74% compliance rate might lift with the benefit of Esselstyn's data. Additional support mechanisms regarding food availability could alleviate the difficulty of dietary change. I hope you review the material and media I have sent. I do appreciate any feedback. Regards, such and such. I have received no further feedback from the Professor. Now let's move on. In reply to the esteemed endocrinologist's request for any further information, I forwarded him a copy of Dr Gabriel Cousens' DVD, Simply Raw, Reversing Diabetes in 30 Days. I did this approximately 18 months ago in 2008. It is now 2010. Here is a rundown of what evidently happened. The endocrinologist claimed to have misplaced the first copy. I sent another copy of the DVD by mail. He claimed not to have received it. I did not contact the endocrinologist again until March 2010 this year. I decided to recontact the endocrinologist in March as I had watched a TV article regarding a police officer who alleged to have come off his diabetic medications after having lap band surgery. The TV article was not specifically about diabetes reversal. Anyway, this time I included some additional articles regarding diabetes reversal for the endocrinologist. These included an article about British national Clive Dunstan, who came off his diabetic medications after having gastric bypass surgery. Two articles about Sean Holbrook, who came off his diabetic medications as a contestant in an Australian version of The Biggest Loser, And finally, 2 articles regarding an American, the biggest loser contestant by the name of Daniel Wright, who also came off as diabetic medication. I prepared the documents with a letter and another Dr Gabriel Cousens Simply Raw DVD and forwarded them once more. The endocrinologist replied via email, such and such. Thanks for your interest. I'll have to take some time to read through your information, but there is little doubt that significant weight loss, bariatric surgery or via exercise, such as in The Biggest Loser, but also more moderate exercise can lead to very significant improvements in the metabolic state, including blood sugars, hypertension and lipids. Whether the diabetes is cured is less certain, but very significant improvements can be made, including normalisation of the glucose levels following a glucose tolerance test. Surgery is becoming more popular, especially at such and such, but needs significant changes to diet also. Bypass surgery is popular elsewhere. I hope you understand that I'll do my best to go through the information. Most nights are spent correcting or dictating patient letters as well as preparing talks. Cheers, such and such. After 11 weeks of not hearing back from the endocrinologist, I wrote an email displaying my disappointment. The endocrinologist replied that, quote, I had no idea I had a timeline to respond, and that I will certainly endeavour to return the materials. I promptly returned an email explaining that I can wait a longer period for a response. The endocrinologist then returned an email. Dear such and such, I apologise for the lateness of this reply. My emails have changed server and I have had a lot of trouble accessing them. There has also been an unforeseen illness in the family. In the interest of having someone look at the material more promptly, I have already sent most of the package to such and such. There will be some material missing, and for this I apologise. I have had to move office a couple of times. I will be more than happy to pay for any costs. I wish you all the best. Regard, such and such. I also asked of the endocrinologist that if he could not review the material, could he please name a doctor and refer me to them. Instead he referred me to departments and organisations, which I did not want. I decided to do this video to illustrate the attitude of 2 health professionals regarding the pioneering work of Dr Esselstyn and Dr Gabriel Cousens. I would also like to inform viewers that as of today, Sunday the 6th, 2010, the 11 uploaded videos on the Cancer Video 08 YouTube channel have received 39,933 views. I have had no inquiries from any health professionals regarding the testimonies. Goodbye for now.